Welcome to the Throttle Up Leadership Podcast. Our theme for 2025 is the future of work. Meaning is the new money. In a world shaped by rapid innovation and constant change, the pursuit of purpose and impact has never been more important. I'm Dr. John Dentico, your host, bringing over 30 years of experience in leadership, strategic thinking, and purpose-driven innovation. Here, we tackle the pressing challenges of our time, from the rise of artificial intelligence to the growing need for meaning in the workplace. Together, we'll uncover how leaders can ethically integrate AI to enhance decision-making and keep humanity at the heart of their organizations. Remember, amidst all the technological advancements, in the end, it's always about the people. This podcast is your resource for actionable tools, thought-provoking discussions, and inspiring stories. It's time to go beyond leadership development and focus on leadership impact, creating workplaces where people thrive, innovation flourishes, and meaning truly becomes the new currency. Thank you for joining me on this journey. Now, let's throttle up and dive into today's episode. Hello again and welcome to the Throttle Up Leadership Podcast. It's me again, Dr. John Dentico. This morning I am welcoming Suzanna Martinez. Suzanna Martinez is the founder of PEO for the CEO, a brokerage firm specializing in PEO consulting, HR solutions, and insurance benefits. With over 2 decades of experience in the PEO and insurance industry, she helps businesses find the right PEO partners to streamline payroll, HR, and compliance while optimizing costs. I am truly pleased to have her here this morning with me on the podcast. Good morning, Suzanna. How are you?
Good morning. Yes, I'm great. Thank you for having me.
More than happy to have you here. Suzanna, personal touch to my podcasts this year, so I'd like to ask you this first question.
Yeah.
That is, tell me a bit about yourself. Where did you grow up? And in your mind, what were some of the fundamental influences in your life?
Oh, interesting. Yeah, I grew up in Southern Colorado. I'm a third generation Mexican American household. Families always got together, made tamales for Christmas, and I moved to the big city in my teens, and that was Denver, Colorado. And so big part of my life that really helped me get into business was I was a practicing Jehovah's Witness, and I'd go door to door, and it was a good sales training, leadership development classes, and that's what led me into the realm of business development, and I've been in business development my whole life.
Oh, great.
Yeah.
Great. Thanks for that. I appreciate it. Suzanne, I have to ask you this. Explain for me and my viewers and listeners, what a PEO brokerage firm is, what it does, and what is it that separates you from other like firms?
So let me start off by just talking about what a PEO company is. So it stands for Professional Employer Organization Model. Believe it or not, there's over 700 PEO companies. Essentially what it does is it pulls several thousands of employees into a large group to get buying power and economies of scale on health insurance, workers' comp insurance. It also helps companies grow and scale their businesses by helping them with the back-end HR infrastructure when it comes to technology and actually getting certified HR professionals at their beck and call.
Great.
And what a PEO brokerage firm does, differently than what a PEO company does, is a PEO brokerage firm matches the clients with the right PEO company, since there's so many PEO companies. And if you're going to look at changing PEO companies or going with a PEO company, you don't want to just go with the first company that you get a quote from. You really want to do your due diligence, look under the hood, get several quotes. And that's what I do for my clients. I just take that burden off them, and I process several quotes on their behalf and really try to match them with the appropriate PEO company that's going to meet their needs. I represent the client, not the PEO company and not the insurance company.
And how would you differentiate your company or your brokerage firm from others?
There's actually, it's just There's a lot of PEO brokerage firms getting started. In the past, there was hardly any. There was like a handful of national PEO broker firms nationally. This is something I've always wanted to do. Been in the PEO world for 2 decades as an employee and then gone off on my own at 3.5 years. And so now it seems like there's becoming a lot more PEO brokers in the marketplace. And I would say what sets our firm apart is my expertise and my background. I've over 2 decades of experience in the PEO world. I know what to look for, what to negotiate for. Whereas from what I hear, a lot of the other PEO broker firms hire a lot of college students that might not have as much experience in the industry. Yeah, and just my personal touch and expertise. I'm all about relationships and building a good network and solid referrals from current clients and past clients.
Great.
Yeah.
So let me ask this question. With healthcare so prominent in the news today, I mean, across the entire spectrum of what we consider today, just out of curiosity, what do you think the motivation is for more brokerage firms to be getting into the business, if you will?
Offer brokerage, insurance brokerage directly for my clients, but mostly we're doing not just the benefits, but the HR infrastructure, the onboard, making it streamlined for employers to onboard employees onto the benefits and offboard employees onto the benefits. I would say in the healthcare industry, the increases are sky high every year. Companies are facing double digits. People have to be creative. Companies have to be creative. They still want to take care of their employees. They have to look at other options that are out there. And as myself, what I've done is I've become very creative for my clients and looking if the PEO large group, they call the large group master healthcare plan, or other options that can be more creative for them as well. So unfortunately, healthcare is where it's at. It's just increased every year, and companies have to be creative and brokerage firms have to be creative as well. A lot of brokers nationally, they've just been status quo, just renew as is, and it's hard to make any changes outside of the box. So I think it's really opened up the field to a lot of younger professionals in the industry to introduce creative solutions and disrupt the marketplace.
Interesting. Boy, and disruption is the name of the game. Let me tell you, it is really, we don't know where we're going to be 3 or 4 or 5 months from now, and certainly in the healthcare industry.
Yeah.
So it's going to be a very interesting thing to watch and study, which is something I find very interesting from where I said I always like to, I'm very much into watching these transformational changes and what spurred them on and where they went, where they started and where they ended up. I'm going to keep my eye on it for sure.
Yeah.
I'd like to ask, go ahead.
I talked to employees and companies. They were saying, 20 years ago, I remember I used to cover my family and it was $100 out of my paycheck. And now it's like average to cover a family, it's like $4,000. It's a mortgage payment.
It's incredible. It's incredible. Let me ask you this about your company, a PEO for the CEO. Do you have a mission statement? And if so, could you tell my listeners and viewers what it is and how you got there, picking this one?
Yeah, my mission statement basically is doing what's right by the client, basically becoming their PEO advocate, fighting to maximize their right to find the best PEO without overpaying in PEO fees.
Great. All right. I appreciate that very much. I have spent a good deal of my time in the last 2 years focusing on attracting, hiring, and retaining good people in organizations. Contained within those discussions is, of course, onboarding and offboarding, as you can imagine. Can you tell me and my listeners and viewers what are some of the trouble spots that you have seen when onboarding and offboarding talent in organizations?
First of all, companies have a great idea. They're really good at making their widgets, but they don't realize the responsibilities that it comes with being an employer and the burden of being an employer. So as companies grow and they reach certain thresholds, over 20 employees, over 50 employees, over 100 employees, they have a lot more compliance and burdens placed upon them. As they grow and hire in different states, each state has a different rule and regulation on how they hire and fire their employees. And it's really hard to keep up. It's hard for HR professionals to keep up. And so they can really get themselves into trouble when it comes to compliance, fines, penalties. For example, if you don't offer medical insurance for if you're over 50 employees, you will get some fines and penalties. The IRS will do an audit on you. And once you open up an audit for one entity, there's going to be possible other audits, the Department of Labor, the state audits. That's one big piece as far as fines and penalties, avoiding that. And why not hire a company that's an expert in that to be able to help dot your I's and cross your T's? And another thing, when you talk about onboarding, oftentimes you're talking to different companies, different brokers, different insurance companies, different this, different that, different technology, a payroll company. And it's hard for all these companies and people to talk to one another and to integrate with one another. In the PEO model, it makes it very streamlined and very efficient. So for example, if you hire a new employee and you're supposed to offer them benefits at a certain time, sometimes you might forget, if you're doing it manually, you might forget to offer it to them. And then you've missed that window. Or if you're offboarding an employee, sometimes you forget to terminate that employee on the insurance portal, and you're still paying premiums for health insurance, dental, vision, or whatever type of benefits they were on. And that happens all the time. And sometimes you're paying for months and then you realize, oh my goodness, this employee has been terminated for 6 months and we've been paying premiums. Oh, in the PEO model, it's a click of a button. You terminate an employee and then it just communicates to all the different insurance vendors. And so that way you don't have to continue to pay premiums.
Interesting. Yeah, I would imagine it's a very complicated process. And of course, different employees need different kinds of coverage. If, for example, if the person is single, unmarried, they may take one particular type of coverage as opposed to someone who may be married and has a couple of children, and those kinds of things. In your work, how do you figure that out? How do you rectify that in terms of finding healthcare programs that fit, let's say, a multi-generational workforce? How do you figure that out?
Yeah, that's a good point. So what we typically try to do is offer options. And the more options you can offer to the employees, the better. Sometimes if you don't want to offer too many options, because then it parallels people and they can't make any decisions. But I think for a company, I typically work with companies like 40 plus employees to 100. Anywhere, if you're a 100 employee company, this is probably good practice to offer 4 plans, maybe 5 plans at the most, and make it very different from each other. A high deductible plan might be good for a family, and a copay plan might be better for another family. A lower deductible plan, and then a really higher deductible plan. And that gives a lot of options to whatever's important to families out there, and to some are single, some have kids, and they have to take their kids pretty regularly to their urgent care, and they want to have a copay plan. Others are single, they don't really use the benefits very much, but they'd like to be able to put some money in a high deductible HSA account and get some tax benefits. So I think by offering more options to your employees, it makes you the employer of choice.
It's very interesting. I remember when I was in the corporate world, I must have gone through 3 or 4 iterations of healthcare plans. In other words, I was in a healthcare plan with the company for 1 year. And then at the end of the year, they changed everything around. There was a whole different healthcare structure, a different provider. How do you maneuver through that? I'm very curious, because at the time at least for me, I was scratching my head trying to figure out what was the best option for me. So how do you maneuver through those kinds of decisions for, let's say, a family as opposed to a single individual?
This is real life. This is what employers are facing every year, and they don't want to change providers and they don't want to change plans, especially if employees are happy with everything. It's hard to do that, but they have no choice because the premiums are increasing so much drastically. And I would say by joining a PEO model, essentially, and not every case, but essentially what it does is it's pulling several thousands of co-employees together. So the risk is spread out and hopefully can stabilize the renewal year over year. So that way employers don't have to shop carriers and change plans. Sometimes in the PEO model, they might stay with the same carrier, but might change the plan designs a little bit based upon feedback of employees. And so that's the goal, is to try to really find an option where you can stabilize the renewals. And I talk to clients all the time that have been in a PEO for a long time. And as long as they're getting single digit renewals and the employees are happy with the carrier and the plans, they don't want to change. People don't want to change unless they absolutely have to.
I agree. Let me ask you this question because it's a question of curiosity for me. When you gather different groups of people together, do you try to structure it in such a way that, for example, all, let's say, coaches and consulting companies, maybe 10 people or less, do you try to structure them all together as a group rather than, let's say, a 10-person company, a 5-person company, an 8-person company, and then maybe a 100-person company? Does that make sense in terms of how you group that together?
Yes,
go ahead.
It does. So actually, I'll give you a little bit of information under the hood of PEO companies. So a little insight. So what they do is they pull several thousands of co-employees together, but what they do is they risk everybody based upon the SIC code, so the industry, the zip code of the employer, and then the census of the employees and the dependents as well. So we have to gather that data. And AI, a lot of the companies, insurance companies, PEO companies, everybody is doing what AI underwriting. And what they're looking for is to determine the risk pool of that particular group. And in the PEO model, everybody is in one pool. However, each group is on different tier depending on their risk level. So they could change when they get a renewal. If they've had a bad renewal or maybe their census has changed drastically, they can go up a tier. Or maybe it's changed for the better and they can go down a tier as well.
Very interesting. That's a great piece of information. I have to tell you, reading my mind, because the next question I want to ask you is about AI. So we're living through, as you well know, this dawn of a new age in efficiency and hopefully effectiveness, with the introduction and rapid growth of artificial intelligence and its implication for healthcare across the board. How do you see AI integrating into the work that you do at PEO for the CEO?
All the underwriters for all the companies are doing AI underwriting. And there's several different companies that are popping up that are specializing in AI underwriting, and different insurance companies will work, or different PEO companies will work with these companies. But employers are always asking, why do I have to give you so much data? That's why. Before, they still would have to provide that data, but we really just did it based upon the ages and just underwriters trying to determine, once you get a certain age, you might be a risk factor for this, you might be a risk factor for that. And if you have a lot of young males, typically they don't use insurance very often. So let's give them a better rating. But now with AI, it's just really interesting how I can get the same group, send it out to different companies and get a drastic change. Some companies are like, this isn't a group that we want, and others will come back very competitive. That's why I try to send it out to as many companies that I've already vetted. I try to send the groups out to as many companies because it's really interesting to me who comes back competitive and who doesn't. And some companies will be like, we're just not competitive. And I'm like, if they're all doing the same AI underwriting, why aren't they all coming like close to one another? So I think they're all using different AI companies. Not sure which one is more accurate, which one is less accurate, but I think as we evolve here, I think we're going to fine tune it, and it's going to get closer to more accurate data. And it's really important that a group, when they get quoted, that they get put in the appropriate tier, because come renewal time, you don't want to be shocked. You don't want to get honeymoon rates. Yes, you want to get low rates, very competitive rates. But if you're going to be shocked come renewal time, then it's really not worth it. So you want to make sure that you get rates that are based upon the risk of your group.
Very interesting. Do you see, I would imagine, and this is a question, I would imagine because different types of AI companies are exploding. Everything from video creation from ChatGPT to DeepSeek to all these different kinds of Google's model, all are exploding. Do you see companies now surfacing as specifically AI companies in the healthcare industry? In other words, they're pushing everything else out of the way and saying, we're dedicated to AI in healthcare. Go ahead.
That's exactly what they do. That's these companies that these insurance companies are using. That is all they do, is they're looking up the groups, finding out what medical conditions are ongoing, what they've had in the past. A big piece is prescription drug medicine. That's the number one healthcare cost that is driving up premiums for everybody. Some of these pharmaceuticals that we see on TV are $60,000 a year. And so a lot of the pharmaceuticals are really driving up costs.
Yeah, and go ahead.
AI catches those pharmaceuticals, and that's really what they call a GRX underwriting. So that's how they really determine the risk of the group as well.
I recently completed my certification as an AI management professional, and a lot of that is focused on the ethical side of the house and something called explainable AI, transparency. But it sounds to me, at least at this point, and you've brought the point up, and I think that was really a terrific point, about you can submit the group that you're working with to different healthcare companies that are using different AI models, if you will, and come back with different estimations as to what the cost is going to be. Do you, just out of curiosity, this is just a curious question, do you know how or what criteria each one of those companies is using within the confines of AI to make the decision? Do you know that?
Yeah, of the prescription drug benefits. They're what they call GRX lookups. So yeah, to me, like I said, it's just.
But again, I'm sorry to interrupt, but let me just say that, but you're saying that the estimates come back different from different companies. So if they're using the same data, it seems to me the way they're crunching the data is different. Does that sound about right to you?
It must, because why would they come back so different and so drastic? I don't know who's correct and who's not. I don't get the information. Nobody gets the information. The employer doesn't get the information. I don't get the information. Sometimes they'll give me a score of the group, but I don't know specifics.
So yeah, so you don't know how the numbers are being crunched.
No.
In a sense. Okay, great. I appreciate you saying that. We are getting close to the end here as we move down the road. I'm sure we're going to have a few minutes to discuss this anyway. I have to ask you my world famous, I've asked it from people all over the world, a question, and that is the magic wand question. And if you had a magic wand and you could wave it at any issue in the work world that you deal with, what would that issue be, and why did you choose that?
I would ban pharmaceuticals to be able to advertise on TV. People are desperate and they're sick and they're watching TV and they think this drug is going to be a cure for all. So then they go to their doctors and then they ask for this particular prescription. And sometimes the prescriptions help for a bit. They're very expensive. Anytime you see any prescriptions on TV, they're going to be very expensive. And then they might help these symptoms, but then they cause other problems down the road. And I think healthcare in general does not do a good job at getting to the root cause of the problem. It's always just covering up symptoms. I think the healthcare is really good to have. If you get into an accident, you break a leg, you need to go have surgery, orthopedics, your shoulder, athletics, something like that, and it's great. But if you have something chronic and ongoing, I really would like to see our healthcare get people healthy and versus covering up symptoms with pharmaceuticals.
Yeah, very interesting. I talk a lot about, and this is just an aside, the difference between strategic thinking and strategic planning. And the way I differentiate them is in strategic planning, for example, you're trying to find answers to questions. And in strategic thinking, you're making sure you're asking yourself the right questions. And I think that really comes home when you think about anyone who sees a doctor. What is the real problem? What am I really dealing with?
Yeah.
Here? What's the underlying cause? And I think I remember when I was taking care of my mom before she passed away. I was doing elder care with her for 10 years. And I tell people all the time, it's the hardest thing I ever had to do. It's just crazy. And she was on a multitude of different kinds of meds, including antipsychotic meds and different things like that. And the joke I tell to my friends is I almost feel like I have a master's degree in pharmacology because I was the guy approving it all. I was the guy riding shotgun on the stagecoach, if you will, and saying, you want to switch it to this? No, don't switch that one. It's not going to work on her. That kind of thing. And I had to make those decisions, and they were life-threatening conditions, and she lived to the age of 93.
Wow, that's pretty good, though.
It's pretty good, and we got her there somehow by hook or crook. And she was, as the doctors once told me, part of what they called the pill generation. Give me a pill, I'll fix it.
Yeah.
Give me a pill, I'll take it.
Yeah.
Give me a pill. And I was there. Someone has to be that person. That person. I'll tell you a funny story. It's a funny story now. My mother went into the hospital. She had a bleeding hemorrhoid. And she was in a great hospital, Long Island Jewish, as we call it up in there, and a great hospital. And they had, everything had rectified itself and things were going good. But there were things that I noticed that weren't getting done. I went to her, I said, Mom, when was the last time you had a shower? And she said, no, it started with this. Oh, it was the last time you had something to eat. Well, she said, she was starving. And I said, so I went to the nurse and I said, can she eat? She goes, oh, I think she can eat, but the doctor hasn't written the script. So I said, get the doctor on the phone. So I got on the phone and said, Doctor, can my mom eat? Oh, yeah, no problem. I said, Doc, you haven't written the script. You got to write it, buddy. And he said, oh, okay, give me the phone. So boom, lunch came right up, that kind of thing. We went through everything from lunch to brushing her teeth to taking a shower. And I coined this phrase. I called it the whispering caregiver. I became the whispering caregiver. And what I did was I didn't want to assail any of the healthcare providers, especially the nurses, who I believe were doing their best. Don't get me wrong. But I had to come along and be gentle and whisper in their ear, so to speak, and say, maybe we should think about this. She hasn't had this. What do we have to do to get that fixed? And then I would jump into action if I had to talk to the doctor or whatever. And eventually everything worked out. But again, this goes right to the heart of what you're saying. Someone has to be there who's willing to ask the hard question.
Yeah.
What is it that is the problem that we're trying to solve here? Let's not try to treat a symptom. We could treat a symptom to alleviate pain. I got no problem with that. Okay, we're good. But what are we dealing with here?
Yeah.
And I'll just turn it over to you for your reflection on that.
No, I agree with you 100%. And good thing you guys were there to ask those questions and be your advocate for your mom, because there's so many people that don't have anybody by their side to do that. So I personally am a big believer in functional medicine. I do go to a functional medicine doctor myself, and I find it very helpful. The problem that I find is the functional medicine doctors do not accept health insurance, and it's all cash pay. And who has the money to afford to pay cash pay? I'm fortunate that I do. When I talk to the functional doctors and I say, what about all the people that can't afford? And they're like, they can't afford it now, but what about if they keep taking these drugs and then have all these other symptoms and then a list of other things, then they can't afford to not do it. Then by that time, it's a little bit too late. So it's the chicken or the egg. I really would like to see functional medicine insurance be able to be pay for functional medicine doctors.
Yeah. Well, we'll see what happens in the near future.
We shall
With the new
see.
administration and a real focus on healthcare for all, I think we're about to witness some transforming changes. At least I think so. So we'll see what happens.
Yeah, we'll
In
see.
any case, Suzanna, I can't thank you enough for taking the time today to be here on the Throttle Up Leadership podcast.
Thank
I
you.
truly want to thank you for your time. I wish you all the success and the best to you in the future. Thank you so very much.
Thank you. Thank you for having me. Appreciate it.